Okay, good evening and welcome to today's discussion. Um, Here is the first question. A known diabetic presents with recurrent infections. Which is the most likely cause of his recurrent infections? Hyperglycemia, low insulin, high insulin, dehydration. All right. Sorry for the delay. I have some challenges here, technical challenges. Okay, so yeah, option A is the answer. So hyperglycemia is the major cause because with hyperglycemia, bacteria have the audacity to grow and multiply. Um, a patient with an anterior shoulder dislocation presents with sensory loss over the lateral shoulder. Which nerve is most likely injured? Axillary nerve, radial nerve, ulnar nerve, musculoskeletal nerve. Yeah, it's most likely axillary nerve. Someone can type in the group um, to remind others to join us. So it's axillary nerve that supplies deltoid muscle and the lateral parts of the shoulder. A pregnant woman has hyperemesis gravidarum. Which electrolyte imbalance do you expect? Hypokalemia, hyperkalemia, hyponatremia, hypernatremia. I agree with you guys. Hypokalemia. Okay, so the next question: a patient presents with deep venous thrombosis. Which medications? Which medication is the best initial treatment for DVT? Okay, so of course you start with heparin. After 5 days, start with heparin, and maybe after the first few days, you can introduce warfarin, and then after a total of hmm, 3 to 5 days together, you now discontinue heparin and continue on oral warfarin. Um, a woman develops painful blistering skin lesions after starting a new medication. What's the most likely diagnosis? Yes, Steven Johnson syndrome. The closest differential will be toxic epidermal necrolysis. I think when it affects more than 10%, no, less than 10% is erythema multiforme. Between 10% and 30% is Steven Johnson syndrome. Then more than 30% is toxic epidermal necrolysis. The patient presents with a painless, slow-growing neck mass. Dr. Mustafa, I'm taking you out. Maybe by the time you come back again, you will not do it. A patient presents with a painless, slow growing mass. What's the most likely diagnosis? The brachial cleft cyst, lymphoma, lipoma, thyroid nodule. The thing is that most likely answer is like lymphoma, because that description of a slow growing neck mass, although they didn't tell you the location, is it anterior, is it but the fact that they specify slow growing means it's most likely like a malignancy kind of picture. So it's a lymphoma and it's painless. A young man with a young man has a positive Romberg test and absent deep tendon reflexes. Said is lymphoma. The last one is lymphoma. A young man has a positive Romberg test and absent deep tendon reflexes. What's the most likely diagnosis? Multiple sclerosis and tabes dorsalis, peripheral neuropathy, subacute combined degeneration of the cord. So basically, the most likely cause is SC, SCDC, subacute combined degeneration of the cord. And the major cause of that is vitamin B12 deficiency. Like prolonged vitamin B12 deficiency can lead to subacute combined degeneration of the cord. And because it affects the posterior and lateral columns of the spinal cord, to lead to that positive Romberg sign. You know that that posterior cord is involved in joint position sense and vibration. So that's where the person cannot get a sense of where they are, where their joints are at this particular point in time. So they will fail the Romberg test. And then there will also be peripheral neuropathy, which are seen in the absent deep tendon reflexes. So all the options they listed there are causes of like peripheral neuropathy kind of. Multiple sclerosis, as the name suggests, will give you different symptoms in different parts of the body. You can have weakness in the arm, you can have eye symptoms, you can have uh, um, muscle weakness, you can still have peripheral neuropathy, like multiple different parts of the body that are non-contiguous. So you just have symptoms everywhere, that neurological symptoms almost everywhere in the body. So that's multiple sclerosis. Which of the following vaccines is contraindicated in pregnancy? I'll give you and you choose. Hepatitis B, tetanus, influenza, MMR. So the answer is simple. Once you know the list of the live vaccines, you keep getting this question in different formats. Maybe they'll ask you which of the following is not contraindicated in a patient with HIV or a patient with immunosuppression or a patient that is pregnant, things like that. So you are looking for the live vaccines. You don't give live vaccines to pregnant women because they are live, as the name suggests. They can reactivate inside the body. And with a baby inside, the baby that does not have any immunity, maybe will be at risk. The next question says a 45-year-old man with a history of smoking presents with hemoptysis, cough, and weight loss. Chest X-ray reveals a mass in the right hilum. Which of the following is the most likely type of lung cancer? Adenocarcinoma, small cell carcinoma, squamous cell carcinoma, large cell carcinoma. So because of the history of smoking, this patient most likely has a squamous cell carcinoma. They're usually found close to the center. That's why you have the hemoptysis and the cough. And of course, weight loss is a feature of malignancy. So squamous cell carcinoma is strongly associated with smoking.
So, Chief, is this B or C now?
I just said the squamous cell carcinoma.
Okay.
A patient with rheumatoid arthritis is started on methotrexate. Which of the following supplements is recommended to reduce the risk? To reduce the risk of methotrexate related side effects, vitamin B12, folic, vitamin C, calcium. So it's very straightforward. Because methotrexate is basically a folate antagonist. So you need to give them folates alongside. Like when you are treating, um, what do you call it? Rheumatoid arthritis and things like Crohn's disease that you also use methotrexate. But if you are treating malignancy, you will not give folic acid. It's particularly contraindicated in malignancy. You can use folinic acid, but not folic acid. Can catch up the reason. So a patient presents with fatigue, constipation, weight gain, cold intolerance. Which of the following is most likely diagnosis? This one is Salaka. Of course, it's hypothyroidism. The opposite, the reverse, is also true. We paint a clinical picture of hyperdefecation, you know, excessive energy, weight loss, hyperphagia, heat intolerance, things like that. Think of hyperthyroidism. Which of the following is the most common cause of community acquired pneumonia? Strep pneumonia, Haemophilus influenza, Mycoplasma pneumonia, Legionella pneumophila. Of course, strep pneumonia is the most common cause of community acquired pneumonia. So this question says patient presents with sudden onset of severe headache, fever, and stiff neck. Which of the following is the most appropriate initial diagnostic test? If you know that the diagnosis is um, meningitis, why are you doing this? Is this scan that you use to diagnose it? Unless you don't know that the diagnosis is meningitis. For this classical case, you have to use lumbar puncture. Even if they said initial, it's still the initial and the main test you're going to do.
See, but they said sudden onset of all of this. So if subarachnoid hemorrhage is a cause
Subarachnoid hemorrhage with fever.
is it, sorry,
With fever,
can stroke come with fever? Yes.
hmm, no,
I
really
think the
be
catch there is a
surprised.
sudden onset.
What?
I think the catch there is a sudden onset.
Sudden onset, okay. You can pick that. Well, I'll stick with the lumbar puncture. A patient with a history of heart failure. A patient with a history of heart failure presents with shortness of breath, hypopnea, and paroxysmal nocturnal dyspnea. Which of the following is the most likely um, underlying mechanism of action of the symptoms? Bronchospasm, pulmonary embolism, left ventricular dysfunction, pneumothorax. Left ventricular dysfunction. A patient with jaundice, dark urine, and abdominal pain. Laboratory test reveals elevated bilirubin and alkaline phosphatase. Which of the following is most likely the cause? Hepatitis A, hemolytic anemia, gallstone obstruction, cirrhosis. Dr. Mustafa, you again. With the dark urine and all the obstructive enzymes being elevated, um, alkaline, especially alkaline phosphatase, and usually they have pills too. So that's another thing that can help you clinch the case. Or most likely it's gallstone. obstructive jaundice. The other ones there are all pre-hepatic and post-hepatic. None of them is post-hepatic like sorry. The other options are pre-hepatic and hepatic. Only gallstone obstruction is post-hepatic. A patient with a history of alcohol abuse and of alcohol abuse presents with confusion, ataxia, and ophthalmoplegia. Which of the following is most likely diagnosis? Wernicke encephalopathy, Korsakoff syndrome, hepatic encephalopathy, and subdural hematoma. So once you see CoA, think of Wernicke's, then amnesia and confabulation are a feature, are you know a sequelae of Wernicke's syndrome. So when initially they have confusion, ophthalmoplegia, and ataxia, but eventually to progress to become Korsakoff's, where they will now have amnesia and confab. All right. And when they have amnesia and confabulation, that's Korsakoff syndrome. So and vitamin B12 deficiency can cause them. I mean, thiamine deficiency can cause them, and it's related to alcohol because alcohol depletes thiamine. So you see a patient that is chronic alcoholic, the first thing to replace should be your thiamine. In fact, if you present as an emergency, you should replace the thiamine first before you give IV 10% glucose, because if you don't replace the thiamine before you replace the glucose, to make the condition worse, to lead to cerebral edema. So you must replace the thiamine so that when the glucose comes, to have something to work with. They tend to present with hypoglycemia and some other stuff, confusion. Patients with polydipsia and polyphagia and blah blah blah, and a low urinary osmolarity, despite elevated serum osmolarity. Which of the following is most likely diagnosis? We have diabetes mellitus, diabetes insipidus. Mustafa, please move your mouse now. Syndrome of SIADH, primary polydipsia, Your mouse is blocking my screen. Dr. Mustafa, are you here? So those are the options. Last question. So the answer here is diabetes insipidus, because it will lead to high low ADH, right? The patient presents with a butterfly rash on the face, joint pain, and fatigue. Which of the following is the most likely diagnosis? Rheumatoid arthritis, SLE, Yo- Sjogren's, osteoarthritis. This one is baby Christian. The market woman knows the answer. Patient with a history of chronic COPD presents with worsening um, dyspnea, increased sputum production, and fever. Which of the following is the most likely cause? Pneumothorax, COPD, acute exacerbation, pulmonary embolism, pleural effusion. So probably there's a superimposed pneumonia, which is exacerbating the COPD. patient presents with new onset ascites, lower extremity edema, and proteinuria. Which of the following is most likely diagnosis? This is nephrotic syndrome. A patient presents with acute onset unilateral facial palsy, inability to close the eyes, um, and drooping of the mouth. Which of the following is most likely? Bell's palsy. Lyme disease presents as presentation caused by small gram-positive bacteria, caused by gram-negative bacteria, characterized by Bell's palsy, erythema migrans, cardiac block, and arthritis. transmitted by the Anopheles mosquito. So basically, Lyme disease is transmitted by tick, not by, of course, it's not by mosquito. But these are the symptoms in option C. It's neither gram positive or gram negative. It's caused by spirochetes. Cells responsible for innate immunity are activated by glucocorticoids, proline, eosinophils, thrombopoietin. Yeah, sure. In this context, you can choose proline. Another version of this question can still give you other options. If you have proline and you have um, this substance here, pathogen associated molecular patterns, you will choose PAMPs. Gap junctions, Option A, absent in cardiac muscle, of little functional importance in cardiac muscle, provide pathway. Dr. Mama, remove your this thing, your mouse. Provide pathway, I don't know what is there. Absent in smooth muscle, connect to sacrotubular system. Yeah, provide a pathway for rapid spread of excitation from one cardiac muscle to the other. The following can be measured on ordinal scale except cancer stage, blood group, conscious level. Ordinal follows an order. So blood group doesn't follow any order. I'll have to end the session. I have something to attend to. Thank you guys for attending. We'll see you tomorrow.